Everyone. Greetings, greetings. Hope all is well with everyone. We have a packed house, so great to see you all in person. My name is Sierra Douse. I sit on the office of CFO. I also work in OHI with Debbie Khalil on G2G's government to government agreements. So, welcome. Good to be here, you all. Thank you for joining us. We're going to present today on government partnerships for enhanced HIV control and sustainability. We have three distinguished, amazing panelists today to present to you. I want to go over the first one introduced. His name is Kenneth Otiano. He is the Deputy Chief of Party of USAID for the Child. I do want to pause and say the name USAID for the Child, the project name is derived from Kiswahili title, which means coming together to protect, invest, and improve the health and education of the child. I thought that was amazing for y'all to know that. He also works at Moy University College of Health and Sciences. His presentation will highlight an existing county program delivery committee to advance and sustain HIV programming outcomes. I'm also an undergraduate health sciences, so nice to meet you. Welcome. Our second presenter is Koketo Nogoduka. She is from South Africa, the Department of Basic Education. She is a seasoned practitioner in HIV and TB response, policy implementation, stakeholder management, resource mobilization, strategic information management systems, and good, excellent governance. Her presentation will focus on a successful government to government direct agreement for DREAMS programming that strengthen government systems and improve results. Our third distinguished guest is our virtual presentation. His name is Jean Ame Naso-Banano from FXB Rwanda. He currently is the Director of Monitoring, Evaluation, and Learning MEL at FXB Rwanda. He has over 7 years of outstanding experience in learning and managing MEL activities and coordinating small to large scale randomized controlled trials and evaluations. His presentation will focus on co-locating offices with government officials for better results and sustainability. I do want to hand it over to our first presenter. Welcome again. Go ahead.
Thank you, Sierra, and good afternoon, everyone. We'll be highlighting our experience with the county ownership, the case of localization in 2 counties in western part of Kenya, where Moi University College of Health Sciences is implementing an OVC program. So a little bit about the background is that we started this program last year, 2021, in May. And when we started, we realized some indicators that we were struggling in terms of access to birth certificate for orphans and vulnerable children. And at that point in time, that is in Q1 of FY22, we had recorded 56% of birth certificate coverage in Bungoma County and 74% in Kakamega County. And equally challenging was access to the county social protection database, which provides details or biodata information on beneficiaries of the government-driven social protection program, popularly known as cash transfer for those who are familiar. So with localization and the institution of county-led, county-owned, and county-managed programming, the program has made efforts in this regard that we would like to share with you for the purposes of learning. The methods that we used is that we did co-creation, that is joint planning with the county governments, because we implement alongside the county governments, working collaboratively to achieve the deliverables for the program within their jurisdiction. And we also worked through the national structure, that is the County Area Advisory Council, which is a national structure domiciled in the Directorate of Children's Services in Kenya, to form the County Program Delivery Committee. This is a thematic subcommittee as per the provisions of the guideline for area advisory councils. And we went that route so that we give it some form of legitimacy in terms of providing a platform, a legitimate platform for government department officers to be able to support implementation of the program. The membership of the CPDC was guided based on the deliverables of the program. We worked with the AAC to sort of give guidance in terms of who becomes a member of the County Program Delivery Committee. And this we hoped would give us leverage in terms of promoting county ownership and county leadership in program management. It has representatives from the technical representatives from different departments that are relevant in terms of OVC support delivery. We developed guidance for CPDCs, sort of a tool that gives guidance to stakeholders in terms of membership, in terms of terms of reference for the committee, in terms of meeting guidelines and documentation that are necessary to be able to give references in terms of their achievements and milestones. The committee is chaired by a government officer, particularly the National Department of Coordination and Interior. And that is the department that oversees coordination of all government functions within that jurisdiction, the county. In South Africa, that is the equivalent of a province. And I'm sure most other countries also have similar delineations. The Secretariat is provided by the Directorate of Children's Services. Both of these are national, but because child protection, as per the Kenyan Constitution, is still a national function. But we have functions that are devolved to the county governments, but child protection is still national, and that is why we are bringing on board the Directorate of Children's Services. The CPDCs meet every month, at least once every month. And we also have our technical teams at the county level who are also members of the CPDC, as well as our local implementing partners. We work in 5 counties. And in each of those 5 counties, we have local implementing partners and technical officers who preside over implementation and provide guidance to the local implementing partners. So all of which are members. So in terms of local partners, the service delivery coordinator is a member, assisted by the partner director where necessary. The committee, in their usual meetings, where necessary, they assign relevant government departments, both county and national, to coordinate response to address identified implementation challenges. And Bungoma and Kakamega delivery committees identified legal and social protection as thematic areas for support in terms of delivery of the program. So in terms of results that we highlight, in Bungoma County, birth certificate uptake as a result of the input from the committee rose from 56% to 62% in 2 quarters. And Kakamega County rose from 74% to 81%. In fact, as at APR, this was 64%, and the other one was 84% as at APR. And that, we believe, we could partly be attributed to the efforts of the county program delivery committees. In terms of social protection, we managed to access a government database that gave us information that we could compare with our database for registration of households to be able to identify those beneficiaries of social protection. because in OVC programming, particularly in the OVC comprehensive programming, knowledge of that information is important in terms of informing case management and case planning to be able to support progress towards graduation. So in conclusion, we realized that instituting county-led, county-owned, and county-managed structures can make significant contribution towards achieving project results and creating ownership by county and national government departments. Thank you.
Thank you. Excellent presentation. Thank you so much for highlighting the importance of cross-sectoral collaboration. There's no single approach to solving issues, mitigation. So thank you so much for that. And thank you for highlighting the database, how you started there to realize the root causes, root issues, and to delegate. So thank you. Excellent job done. Our next presenter, Ms. Kotika. Yes.
Thank you very much, Chair, and good afternoon, colleagues, and welcome to South Africa. Ever since you came into the country, my voice left me. So I'll try and project, and if my voice is failing me, I've got my colleague here, Ms. Busisano Kama, so she will take over. So I'm going to give the presentation also around country ownership, implementing a government-to-government program in South Africa for the implementation of the comprehensive sexuality education program through the Department of Basic Education here in South Africa. So just to talk quickly around the school population in South Africa, we've got about 26,000 schools across the country in 9 provinces. And this is articulated in the South African Schools Act that says it is compulsory for a child that is between the ages of 7 and 15 years old to attend school. So we've got about 13 million learners in our schools, and we've got about 400,000 educators that are teaching those learners in schools. So over the time as a country, we've seen that as the education sector, the vulnerabilities of our country to impact in our education outcomes. We've seen a high rise in terms of the teenage pregnancies, especially amongst adolescents between the ages of 10 to 19 that are in our schools. Increase in sexual abuse. I think, colleagues, you are aware of the fact that in South Africa, we've just declared gender-based violence as a second epidemic, and it also manifests in our schools. And 15% of our girls would report either rape, sexual harassment, verbal abuse, as well as bullying in our schools. We do have a high HIV prevalence amongst our adolescents, especially our adolescent girls. According to the Tembisa model in 2020, 54,000 adolescent girls were infected with HIV in 1 year, and about 15,000 boys. We've seen also the TB incidence increasing in our learners, as well as we also experience a high learner dropout rate post-COVID-19 of our learners. So as a sector, we had to then respond, and this is the platform that we are responding on, which is a care and support for teaching and learning framework, which is a comprehensive framework that responds to our system. And as you are aware, that the Department of Basic Education, our mandate is teaching and learning, but the vulnerabilities that impact requires us to provide a coordinated, comprehensive, and a multi-sectoral response in addressing these barriers. So in terms of how we respond as a department, we implement a comprehensive sexuality education program through our life orientation subject. So it's taught in the classroom by the educators. But we've got other programs that we are implementing to enhance. So we integrated school health program that provides a platform, provides sexual and reproductive health services in schools. We also implement co-curricular interventions that are driven by peer education. We provide psychosocial support for our learners. as well as we make sure that we implement the school safety framework that addresses issues around GBV. So it was based along this implementation that we then developed how to implement the comprehensive sexuality education. So our approach, we developed scripted lesson plans that the educators needed to implement. So we train educators to implement the scripted lesson plans. We support parents and school governing bodies as well as school management teams in terms of orientating them on the content of the comprehensive sexuality education. We provide access to SRH services as well as we do mentorship outside the classroom. So that is our approach in terms of implementing CSE. So then USG, through USAID agreement, then agreed that this work, because it was embedded in the policy of the Department of Basic Education, let us then take forward the agenda around country ownership and implement a government-to-government assistance that will then support, as I've indicated, local ownership as well as enhance sustainability. Make sure that the transition of PEPFAR engagement from the donor recipient to make sure that it's locally implemented was then taken forward, but also trying to make sure that we've seen the decreasing donors or foreign assistance in different countries, especially for us in South Africa, because we're a middle income country. Therefore, we needed to make sure that the role of government was then implemented. And the financing mechanism of the G2G agreement is expenditure driven. So government, we incur cost, we deliver on a milestone, and then we get reimbursed by USG, and we use a process of co-creation in terms of the deliverables and the milestones that we agree with the support with USAID. So we've implemented this assistance from 2018. We've co-created the design and we developed a work plan. We employed a couple of program implementing people to make sure that there was a focus in the implementation. It is a fixed amount reimbursement. So we rejoice when the dollar rand exchange rates changes. But as soon as the fuel price and the food price starts increasing, then we are in trouble because we have a fixed reimbursement amount, and we have built in a strong monitoring, evaluation, and reporting component to make sure that implementation is tracked. And for us as government, we are also using G2G to pilot interventions that we can then be able to roll out the implementation across the country in schools that either are receiving funding from the Global Fund agreement or are receiving funding directly from the support of government. So we've had implementation successes. We have managed to build a close relationship between the Department of Basic Education and the USAID appointed agreement technical representative. And this is the person that we speak to every day in terms of tracking implementation. And I think we all know, sitting in this room, how USG, USAID, PEPFAR is big on do's and don'ts. So we always check with our GATR as we are implementing, in terms of making sure that because it's a reimbursement, if we implement a milestone and we implement it incorrectly, then government will be liable for that expenditure. So that relationship has been critical in making sure that we implement the G2G. The close working relationship between the department as well as our national treasury was quite important, because the money that we claim from USAID flows through the treasury systems, and we had to make sure that as a department we are able to track that payment and we are able to claim the money that was spent back into the fiscal of the department. We had to make sure that we are in alignment with host government. In this case is South Africa, with USAID supply and chain management policies. As I think I won't go dwell much on that. I think all sitting in this room, we know how that can be tricky and trying to align to government processes. we had to have an understanding and appreciation of the grant administration and legal frameworks from both governments as we're implementing this government to government. We had to make sure that at times we have the lawyer from the Department of Basic Education, the lawyers, the state lawyers from National Treasury, as well as the lawyers from USAID, to make sure that we are in alignment in terms of ensuring that we align the legal frameworks for implementation. This program has also gave us an opportunity to strengthen the capacity of the province as well as the districts in terms of coordination, implementation, and oversight of the implementation of the G2G program. So for us, in terms of lessons learned, the capacity for the department to take on a government-to-government assistance continues to improve over time. I think we are all aware in terms of how PEPFAR changes in the middle of a PEPFAR year, of a COP year, and there's a whole lot of things that changes. But also from our side as government, I think you're all aware that we, in the middle of an administration, we change ministers, we change premiers, we change everybody as we go along. So we had to make sure that the capacity for program implementation remains, and we made sure that all the relevant team players and role players, both in the South African government and the US government, remain knowing what we're trying to achieve with the implementation. The government-to-government resources facilitated the strengthening of the program components, the roles and responsibilities of learner support agents through capacity building. So what we had learned from the PEPFAR implementation as well as RIMS implementation was to make sure that the different cadres that were implementing the program were capacitated. So our learner support agents, and these are linkage officers, were then critical to be trained. So we designed capacity building interventions, and that strengthened implementation. Some of the challenges that we had were delayed in the approval of the work plans, and this at times interrupted implementation. The non-alignment of the fiscal years, as a department, we literally have 3 years. We've got the COP year, we've got the financial year, which is the South African year, that starts on the 1st of April, and then we've got the academic year that starts at the beginning of the year. So we had to make sure that we do the alignment, as well as we made sure that there was provincial and district buy-ins, but as well as I've indicated that strong relationships with RIMS implementing partners, because G2G was still falling within the RIMS approach, and we made sure that layering, referrals and linkages continued to happen for our adolescent girls and young women. So in conclusion, the inclusive engagement between USAID and DBE has been central and is still a requirement for us to achieve and scale up the services that we needed to implement, as well as improve the acceptability of the interventions, as well as ensure that because Treasury is on board, the domestic investments around CSE will then be taken forward as we take forward the agenda around sustainability. Thank you very much, colleagues.
Excellent job, G2G champion. We're going to have to get you to speak at one of the G2G webinars. Thank you in advance for signing up. We have one more speaker for virtual. I do want to highlight, thank you for the services you're offering. It's like a one-stop shop because the service for children, it helps prevent absenteeism from education. So thank you. I just noticed that. So thank you, G2G champion. We have one more speaker. He is virtual. And I'll hand it over to you, Jean Ame.
Right. Greetings, everybody. All right. Greetings, everybody. These are participating in a person that is South Africa is treating you very well. And thank you so much for having us. We are really happy to be part of this fourth annual USAID Global Health Local Partner Meeting. I'm presenting virtually from Rwanda, and my name is Jean-Aimé Sabimana from FXB Rwanda, where I serve the organization in the capacity of Director of Monitoring, Evaluation, and Learning. So FXB Rwanda is a local non-government organization which operates in Rwanda and is affiliated to FXB International. FXB Rwanda is a local our endeavors aim at serving vulnerable populations throughout Rwanda, where we develop programs that are complementary to each other with the objective of fostering access to basic human rights and promoting social justice. Today, I'm presenting on our organization's approach of placing its field offices in the proximity of health facilities in the local government authorities' offices for improving the stakeholders' engagement in HIV prevention programs. Now, first, a little bit about the background. So FXP Rwanda has an outstanding experience working with the USAID PEPFAR in HIV prevention-related interventions since 2009, with the aim of preventing new HIV infections and the reduction of vulnerability among HIV affected and infected population in Rwanda. So, during this partnership, orphans and vulnerable children, their household and adolescent girls and young women are served. Currently, FXB Rwanda secured a USAID 5-year cooperative agreement to implement the Thrive OBC and Dreams activity under the program named Thrive Let Us Protect the Children. So this program aims at reducing vulnerability and HIV incidence among orphans and vulnerable children in their household, also on the side of adolescent girls and young women in a high HIV burden district of Rwanda. So we are operating in 3 districts, and that's where we are implementing this program, having OVC and adolescent girls and young women as our beneficiaries. Next. Okay, let's get into our topic of today. So now, what is the rationale for FXB's power of proximity? As we know, next, the success of HIV/AIDS preventive and treatment care intervention require program stakeholders to be engaged in the programming process. As a rule of thumb under FXB Rwanda settings, before any program initiation, we do stakeholders mapping survey to know which stakeholders are available in the community and which ones we look forward to fostering our collaboration with for an efficient and effective program service delivery. So through our past work experience, we have seen that local government officials and the healthcare institutions are important and key stakeholders in HIV prevention interventions as we work with them hand in hand on a daily basis during the project cycle. So to promote this cycle, there's a culture FXB Rwanda places its field offices at the health facilities and the local government premises for a sound and coordinated effort on our programs. Next. So this graph shows our field offices distribution across the 3 districts that we operate in and serve. Normally, we do have a total of 36 field offices. 25 of them, which represent 70%, are located at health facilities, whereas the remaining 11 field offices are represented at sector offices. And what is the importance of placing our field offices in the proximity of health facilities in the local authorities' offices? And what have we read as benefits of this approach? Next. So as I talk about the power of proximity and its benefits, I wanted to emphasize on our program staffing structure in the community and how this structure really works closely with the health facilities staff and the local leaders for improving the program outcomes. So in the field, we really appreciate the work done by program field staff, volunteers, dedicated facilitators, case manager volunteers, both working on OVC interventions and mentors on dreams endeavors, as they are synergy contributing massively to the fidelity and the program and significant output. So we do the program field staff based at health facilities or local government offices. So they are in charge of coordinating program field activities, ensuring that in sustaining the work collaboration with health facilities, specifically the facility leadership team and nurses working in volunteer counseling and testing units, commonly known as the PCT. So we also basically facilitators who are program volunteers based at health facilities and they support on the clinical services for office beneficiaries, including HIV testing, viral load tracking, and the adherence to a retroviral therapy for people living with HIV. And of course, we do have the case managers conducting home visit to the beneficiaries, but also supporting on the creation of care plans for our beneficiaries. Based at health facilities and working closely with visit nurses and on daily basis, our program field staff and those volunteers lead help system to work and facilitate active linkages and the referrals necessary in serving obviously and vulnerable adolescent girls and young women. So as a matter of fact, this has resulted in increased adherence on retroviral drugs for people living with HIV and improved service delivery for the program beneficiaries. I want to give like two simple examples. So during lockdown, it's all about the service delivery in terms of distributing antiretroviral drugs to our beneficiaries living with HIV. So during lockdown, feed staff as they are based at health facilities, I would gather information for instance about appointment to collect drugs for living with HIV. I mean those whose beneficiaries whose appointment to collect the drugs are in request. Then you have this kind of appointment information. This staff would organize and coordinate the distribution activity of drugs to our beneficiaries. So our program staff will be hire motorcycles. We will normally call them border in East Africa for the program linkage facilitators. So the linkage facilitators will behave something like a boarding pass, go to the health facilities or health center, and specifically in the voluntary counseling and testing unit, talk to the nurse and collect antiretroviral drugs and be provided with a list of beneficiaries living with the HIV who they will reach in their respective homes and deliver drugs to them. So this was possible because of working closely with the health facilities and the local authorities. So for beneficiaries in special cases, they would need like maybe we would need like a social support. They would be there. Their cases will be communicated through our program staff and their nurses at the health facilities. Another example is that we got from the testimonies in health facilities. So they reported an increase in the number of people seeking for HIV testing services because of joint planning between health facilities and the staff based that the health facilities. Through conducting HIV risk assessment, for instance, for our program beneficiaries, we could come up with a list of those that needed to get tested for HIV. Then mentors, as facilitators on the ground, would, in collaboration with the program staff and the nurses, would coordinate the booking for HIV testing activity and invite those beneficiaries at the health facilities where they would find the nurses ready to serve them without wasting their time. So, and again, next. Normally, so as you see on the pictures, those are the kind of stuff that we have. We have the program staff together with the visit nurse and the linkage facilitators who work together on a daily basis for serving our beneficiaries. So, and again, we talk about the information sharing between program and staff. Because different program indicators like prevention support indicators, testing and treatment indicators to track are recorded in a way that information and data sharing between program staff and the health facilities is live and maintained. So, of course, we see some of the benefits, which is about the resume support. Next. So in proximity with the local government premises, we have seen different benefits, including program understanding and aligning expectations, because this is very crucial in terms of when we look at the program sustainability, even if the program phases out. So when we align expectations with local leaders who stay as the program phases out, So we really built on that and leverage on those knowledge about HIV prevention, which is community to reach, organize different community outreach, but also having the offices located in here, government premises. It really helps on the feedback loops for improving the program delivery. And again, so it leverages on existing HIV preventive and care intervention to reach more people. So as I conclude, as a direct outcomes we have seen, so we have seen like there is a viral load tracking, appointment followed, referrals made are supported on time, and we have seen like people living with HIV taking those antiviral drugs, they are there on them, and also their appointment given by the nurses, which result in viral load suppression, but also those who need psychosocial support are provided with those kind of support on time. So as I conclude presentation, so there is a very short video about testimony from our program beneficiaries and stakeholders, which I want everyone to watch. It's very short. Thank you so much.
My name is Claudine. I'm in charge of HIV unity at Nyakariro Health Center. FXB staff has been working with us since 2020 under USAID funded Turengera Abana program. We work hand in hand with the program staff as he's based here in Health Center building. Working with him has facilitated the referral system. It has also increased the number of clients served under HIV Unity and Youth Corner. The sharing of information is also easy as well as the follow-up of our clients. It is very important to work with him in the same building. Thank you.
Hello. Martina Mahebe from Operation Military School, located in the Engeri sector. I am an FXB beneficiary since 2021. I attend space and dreams interventions, and sometimes we also to Health Center for testing services, well as psychosocial support. Personally, the mentor referred me last year for HIV testing. When I reached there with the support of the sector level FXB staff based on this health center, the service was rendered quickly. I have the same information from my colleagues that they appreciate the service at the health center with the support of FXB staff there. Because of that, we are not resistant when it comes to FXB referred service compared to usual health service provision. We are even wishful to always have their referral even with our other personal health issues so that we can be helped so people very settled.
Thank you so much for the wonderful presentation. Health centers, community health centers, if you all have a chance to visit one, highly encourage. They're really great facilitator centers in neighboring communities. It can act as a one-stop shop for HIV services, dental, family planning. So I highly encourage, and I'm an advocate for health centers. I used to do one in graduate school. So thank you. Wonderful presentation. Looking forward to questions. If I didn't tell you, this is the room where I call on people. So please excuse me in advance. So looking forward to questions. We're going to take questions from the chat as well as in the room. But we do have one question we're going to do from the chat.
Yes. Okay. That's... Oh. Sorry. All right. Hello. Okay. Okay, so we have one question from Michael K on the chat. For ownership and sustainable support, what are the vital elements that need to be addressed by country leadership, and what suggestions and approach would you recommend to facilitate service transitioning? Do you want me to read it again? I'm going to go one more time. Okay. For ownership and sustainable support, what are the vital elements that need to be addressed by country leadership? And What suggestions and approach would you recommend to facilitate service transitioning? So I think this could be for anybody.
So you're picking on me. I think for me, it's not at the end. It starts with the planning. What donor programs are going to be funded? Are they aligned with the policies of the host country in terms of service provision? And over time, it's agreeing in terms of what are the elements. For example, in South Africa, we then decided that commodities for providing HIV programming will be bought by government, and FAO will then support all the other elements. So laboratory services, drugs were the responsibility of government to procure, and over time, even the staffing, government had to take over, and partners had then to focus on ensuring that you do with programming, referrals and linkages, capacity building, and sometimes buying of equipment. But the routine program implementation elements within the responsibility of the government. So that has assisted in the transition as PEPFAR has been transitioning, either moving to different health facilities or moving to different districts. The ARV program then remained consistent over time. So it's the same approach that we've done with the Department of Basic Education to say when you support the department within the TRIMS package, what are the elements of the TRIMS package are aligned with the education sector policy, and let us collaborate in those so that we can be able over time to transition the implementation to the government. So I'll ask my colleague to add.
Perhaps to add is that government officers operate within an established structure and protocol applies. And so engagement with the government officers requires you to recognize those hierarchy of relations, but at the same time give room for government operations to take its course. Our experience, for instance, in the creation of a county program delivery committee is that we went through the government structure and we gave it legitimacy so that government officers feel comfortable to participate. And the invitation is then done by the chair, who is the National Government Coordination Officer. And then the secretariat is done by the Directorate of Children's Services. So that allows the government officers to respond to, invitations following the protocol of the government. Yes, thank you.
Thank you. Excellent answers. We're going to take questions from the room. Yes.
Thank you for those excellent presentations. I was struck by everyone mentioned co-creation as like a really critical piece of developing the programs and even co-locating to really be constantly in touch and communicating. I wondered if you saw any downsides of co-creation. Were there any challenges with the co-creation? Was it easy? Did it work really well? What were some of the struggles with co-creation? Because I think we hear these things and then we think, oh, we're going to put co-creation into everything. But, what should we learn about the best way to do it?
Yeah, thank you. One of the things when we experienced when we did co-creation is that we came at a time when government programs had already, started, and sometimes because of the difference in terms of financial year, government in Kenya, for instance, our financial year starts from July 1st to June 30th the following year. But for PEPFAR programming, it is actually October 1 to September 30th. So that difference in terms of financial cycle perhaps presents some challenges, because then even much as you can plan together, but of course the timelines for delivery, because it goes with resources, that becomes a challenge. But at the same time, one of the things that we realized during co-creation is that to maximize participation of government officers, there was inclination towards taking them outside station. And of course, that comes with resources, because then you have to invest in DSA, per diem, for those of us who are familiar with that, and then the logistics that go with it. But when you do that and you get their buy-in, then their participation becomes much more, beneficial to the program of the day. But again, it is not something that you'd recommend, because it comes with the resources. It comes with resources, and then it comes like a transactional relationship. Yet we are moving towards transformational relationship. So it's a discussion that you cannot win in a day, but it is a discussion that you continue to engage with them to better understand. And through co-creation, you also disclose the resource envelope. Like for instance, in Kenya, we have PEFA, we budget by county. So you throw it to them that this is the resource that we have, and therefore, if we go that direction, therefore, we are not going to have resources for service delivery. Yeah, so that co-creation provides a platform for us to engage at that level. But at the same time, there is also the element of cost share. Like Moi University is a public institution, and as the prime, we have the responsibility to coordinate our contribution collectively as a program in terms of meeting the requirement. But at the same time, when you engage with government officers through co-creation, they better understand the program and the role that they can play to be able to help you meet some of the deliverables. So I would say it is not a smooth sailing approach per se, but it is work in progress, and hopefully in future they will be able to get better understanding in terms of how to do it. But it is a good start. Yes, it's a good start. Thank you.
Thank you very much. And then just to add from the government perspective, it's everything that my colleague had indicated that as a government official I'm expecting, but also on top of that, it's a value add. The program that you are bringing must add value to the government processes and the government agenda. So it cannot be a parallel agenda in terms of where the government is going with policy direction as well as programming. But also, I think you've touched on the issue around transparency. Because if you are a partner that is coming to say, I can support you with APC, if I don't know how much resources you have, I will then start asking for everything that I'm unable to achieve with the government fiscus. So that open relationship and transparency always goes a long way. But also the issue around the continuous engagement, because sometimes partners approach government when they need MOUs and needs to be introduced for implementation, and you never see them again. And it creates challenges. So the continuous engagement, the continuous discussion, and ensuring that as government changes strategic direction, the partners are on board, they would know, because there is open conversation and open discussion. So it is not as smooth sailing as my colleague is saying. The word is fancy, co-creation, but that we as government, we've already created a program. As a funder, you already created a program. So how do we bridge those two programs and make sure that there's alignment? So the co-creation is not as deep as the word sounds. We don't start from scratch. So it's building the two programs and ensuring that they meet halfway.
Thank you. Thank you so much. And Jean Ame on the line, would you like to answer Debbie's question? Can we get him?
So I think first the question which was about the ownership and the sustainability. So in the context of Rwanda, so what we think and what we do as an ideal and the best practices in terms of creating this ownership and sustainability is first of all through like joint and planning meetings with different government institutions, because the program are being delivered in the community. So we try our best to align the programs with the government goals or country priorities. So in how we think about the health sector, so we see different lines where our programs, especially for HIV prevention, aligns with the government. So there's an alignment with the program priorities, country priorities, but also we leverage on the existing community structures to build the ownership because in the context of Rwanda, so we do have a different health structures supporting on health strengthening at the community level, doing like people we call friends of our family, and of course those people that are serving us the program as volunteers, they really reside in the community. So that's point number two. The point number three is involvement of private sector. For instance, if you take like people who are being enrolled for TVET programs, so we do hand in hand, as I said, we do like a stakeholder mapping, and we see which business owners from private institutions that we can connect our beneficiary to. So that is another thing. The other thing is about providing trainings or building capacity of the people that we are helping. We see that is something that will remain, it's a knowledge that will remain in the community and will really contribute to the sustainability and buy-in even of the program interventions from the side. But also, it's all about, so as my colleague have mentioned, it's all about bridging or aligning and merging our efforts for improved health interventions outcomes. So I've seen that from the co-creation, for instance, it's all about aligning expectations, but also looking at who we will be working with. Like, for instance, if we mention people we may be working with, where we would be needing like a memorandum of understanding for better service delivery and also creating a good and favorable environment for program implementation. So I see that creation is really helpful, but I haven't seen like something I would call like a big challenge because most of the programs that we are implementing aligns with the government or country priorities, specifically the programs are implementing. Thank you.
Thank you. Thank you so much. We have another question from the room. Go ahead, sir.
Okay, thank you very much. Yes, my name is Peter from Botswana. Thank you for those inciting presentations. And one key issue which came out of Rwanda and Kenya was the issue of observing protocol to get buy-in from government. And I just wanted to find out from the two presenters in Kenya and Rwanda, to what extent have you managed to overcome bureaucracy, which is always associated with governments in other countries? Thank you.
Yes. There is bureaucracy, of course, but of course governments are evolving with time. And these days, especially in Kenya, we are witnessing a very friendly government. And much as they still observe those line of authority within their systems, but they are more accommodative of partners who are supporting their cause. So what you have to make sure is that when you are going to the government office, you have already identified where you are, what's common between the two of you in terms of objectives and the gaps that you are going to support to fill. Because as you know, governments the world over perhaps especially in Africa, I would say, are resource constrained. So they hardly have adequate resources to implement government plans and programs. So they would like to have partners who can be able to leverage from, and that is what brings us closer to them. When you have that already clarified, then you get more receptive government, accommodation to be able to drive your agenda. And therefore, we take advantage of such kind of opportunities, and through co-creation, we come to a table and clarify and get to know. For instance, in one of the counties, when we did co-creation, there was a need to renovate a government office. For us, there was a need to co-locate. So we came together to a consensus and agreed, okay, provide us rooms, let our staff sit with you side by side, but we are going to seek approval from USAID to renovate, which we have done, and therefore we have been assured through a documentation that we are going to co-locate with them for the rest of the project period. So I think it's alignment of priorities and objectives that brings us together, and that helps you to minimize those protocols and bureaucracy. Thank you.
Jean Ame, would you like
All right.
to?
I think my yes. I think my response would not go far from what my colleague from Kenya has said. And of course, maybe my say bureaucracy is somehow outdated and obsolete, as we have seen from this growing government will support different programs. And I see the way we overcome this. One of the things we do as joint planning and field monitoring together, because from the as we see from the program initiation through AIDA from the co-creation, as we have identified who we might be working with for better program outcomes. So we do like kind of joint planning and field monitoring together, which really minimize this kind of bureaucracy. But also in terms of getting served, as we serve people we call beneficiary, but on the side of the government also, it's the people that they are supposed to be supporting. So we do a kind of aligning expectations, but also through something that happens on the side of Rwanda, which is called the Accountability Day. We do go in the field with local leaders to respond to beneficiary questions and the concerns. From that perspective, we see and we build this kind of avoiding different bureaucracy as we implement programs, but also from the initiation phase. So that's what I can add.
Thank you. Thank you so much. For the sake of time, we're going to end questions. But again, I encourage you all, you see the presenters, to collaborate before you leave, to go back to your missions, to your organizations. Excellent presentations. Thank you for the questions. Really appreciate it. Wish we had more time. We have not forgot about you, chat room. We will jot the questions down and hand it to the panelists to get an answer back to you. I do want to ask the panelists before we end if they want to say one last final word to our audience.
Thank you for listening and for your
Yeah, thank you so much for listening in.
Thank you. Thank you, everyone. Have a good day. Collaborate.